So my talk was all about the development of new therapies for patients with a very rare group of diseases called epidermolysis bullosa. Now, there are only about 5,000 or 6,000 individuals in the UK who have EB, but they create an enormous burden of disease for themselves and for the health service. And for clinician scientists like me, my job is to try and come up with some new therapies for these patients and to test them, to try and improve their quality of life and to do something about living with this terrible disease, EB. There have been an enormous number of advances for patients with EB, incremental advances, and those cover a lot of different types of therapy. So, for example, we are trying to improve patients' symptoms. We're trying to improve wound healing and pain and itch, and we use conventional drugs, of course, but we're discovering that there are new products that we can put onto the skin or take orally, and those are entering clinical trial to try and improve those symptoms. But at the same time, we are developing a deeper understanding of the molecular pathology of EB and just what it's going to take to develop corrective gene therapies or cell therapies that go after the underlying problem and really try and get that fixed so that we can get closer and closer to a cure. The important thing about EB is there's no single answer at the moment, and that's why it's important to invest in research and to carry out clinical trials of all these different therapies. So there's a lot of excitement in gene therapy at the moment, but gene therapy is complex. You need to target stem cells, you need to be able to correct the gene function in different parts of the skin and different parts of the body. But perhaps some of the more exciting changes that are applicable to patients' quality of life at the moment are to do with cell therapy. Infusions of cells via veins to try and reduce inflammation. If we can reduce inflammation, we get better wound healing, less pain, less itch, and improved quality of life. And I think what we're talking about now in terms of changing patients' lives is to get them used to these new therapies that can improve the quality of life, improve their symptoms. And at the same time, in the lab, we continue to work on the detailed disease pathology so that we can develop corrective therapies and so that one day we can say, yes, collectively we can cure EB.